Welcome, friends. Thank you so much for joining me today. I'm Jen Hilman, and in this video, I'm going to be teaching you some simple massage techniques to relieve chronic low back and sciatic pain. So sciatica is an issue that comes up frequently for my massage clients, and as a new therapist, it's important to know how to treat this chronic problem that is really pervasive in our culture and our society. So when we're looking at sciatic pain, we're really talking about the sciatic nerve, which is the main nerve that comes out of the low back of the spinal cord here, travels through all of the glute muscles, and feeds all the way down the entire leg. And that's why people can experience sciatic pain directly in the low back, in the hip. It can lead to numbness or tingling or pain sensation anywhere down the leg. And that inflammation in the sciatic nerve oftentimes can be a result of chronic tension in these muscle areas. So a lot of times when people are coming to me complaining of sciatic issues, I know right away that the main areas that I want to focus on in that massage are going to be in the low back, in the hips, as well as working into the hamstrings and the IT band. So in this video today, I'm going to show you some simple techniques to work into the low back, into the SI joint, and into the glutes to help relieve that chronic muscle tension that will start to alleviate the pressure and the tension in the sciatic nerve. So go ahead and like this video, give it a thumbs up, add it to your list of favorites so you can come back and practice along anytime. Please leave your comments below. Let me know what other areas of the body you're interested in learning about. And don't forget to subscribe to the channel and join our growing community. And with that, we will jump right in and get ready to work into that low back and hips to relieve that chronic sciatic pain. So I'm just using a little bit of unscented almond oil. This is one of my favorite oils to use in massage. So just making my way, I'm going to apply a gentle layer of oil just to help lubricate the skin, particularly focusing into the hips and low back. And in general, I would incorporate these techniques into a longer full body massage. But even if you have someone coming to you for a short treatment and they are seeking help for this specific issue, it really doesn't take a lot of time to target the specific muscle groups that can contribute to that sciatic pain. So you can really help and provide a lot of relief for someone in a pretty short amount of time, which you'll see in this video. So I'm just starting with some gentle warm-up, kind of effleurage techniques. Just starting to warm up the area, applying a gentle, broad pressure. And as I'm working in a downward motion. And as I come down towards the SI joint and the sacrum, I'm giving a little extra pressure down towards the heels. So creating a little space into the low back and also helping to open up some tension in the SI joint. Now the SI joint is where the sacrum and the pelvis come together. So it can take a lot of pressure sometimes, and it can be one of the major contributors to that sciatic pain. So decompressing the SI joint is really helpful when you're looking to relieve that pain. So I'm just starting to work with some alternating movements, and as I'm increasing my pressure. Still not working the deepest pressure possible, but starting to make a little deeper contact with the muscles. And so I'm working across the QL there in the low back, and coming up along either side of the spinal ridge on the sacrum here. And just kind of making some gentle circles outward. So I'm using this kind of kitty paw, making a light fist and using the flat parts of my knuckles here. This is one of my favorite tools that allows me to get a pretty steady, firm pressure without any specific pressure in one particular point. So it's a nice broad pressure, but I can get pretty deep. So it's a really nice way to kind of survey the land, if you will. So this allows me to start to get a sense of where there might be some trigger points or some knots in the muscle tissue. So this is a really great way to start to kind of take an inventory and see what's going on in your client's body. And once you start to notice and hone in on any particular areas that feel tight, now we're getting clued in on where we need to focus our attention. So I'm going to start to move to one side. And oftentimes I like to start in the low back and just kind of work my way down into the hip. So I'm using my thumbs here to make some small circles just to the side of the spine. Now I am working into the quadratus lumborum here, which can be a big contributor to low back pain and just general tension in the low back. The QL can be kind of sensitive for people when you start to massage into this area, especially if they're tight. So it's important to start with a lighter pressure and slowly begin to deepen your pressure and just notice what's happening with your client's body. If they start to tighten up or flinch or resist, then you know that you've kind of hit that edge. And as I'm using my thumbs here, kind of using the flat part of my thumbs, it allows me again to kind of survey the land and start to get a more detailed picture of where the tension is hiding. And for my friend Sky here, I can feel that there's a little bit of congestion right at the top of the QL there. And that congestion, it just feels like an area where the muscle's a little bit more dense. It feels, sometimes can feel kind of lumpy or kind of gravelly. So there's some different textures that you might notice, but anything different than just a soft, spongy, supple muscle tissue, that's going to be an indicator of where there's some tension being held. So as I hone in on where that tension is, I'm making smaller and smaller movements, really working to target those tight points. And so I've kind of dialed in on this one particular area that feels a little tighter than the rest. So I'm just using my thumb to apply a steady pressure here. And then you can incorporate some gentle movement as well, maybe some small circles or a little vibration, just kind of rocking. Or you can alternate your thumbs, but still just focusing on this one particular area, wherever it is that you notice on your partner's body, right? Everyone's body is different, and every massage is an opportunity to learn and have a new experience. And so once we've started to loosen up any tight areas into the low back, we can start to take this journey a little bit further down the spine, starting to turn my attention now more towards the sacrum and into that SI joint. And you can kind of easily detect where the SI joint is happening, where it comes together, it's often you'll see these kind of little dimples in a person's low back there on either side of the sacrum. And those dimples are generally kind of occur where the SI joint is happening. So it kind of gives you a little indicator there. But here I'm just using my fingers to kind of trace the line of the sacrum. And you can start to detect where those attachments are between the sacrum and the top of the iliac crest. And it is a bit detailed work here. So there's a lot of bony landmarks that are coming together in this area. And of course, we don't want to massage directly onto the bone. That's not really going to feel very good. But we want to work into the attachments, those ligaments and tendons that are coming together. And that's where things can get really tight and kind of clogged up. So we want to focus our attention in those areas. So again, I'm using more of single digits, single fingers to start to isolate some of those attachments. And even here, you can start broad and start general, and then you'll begin to notice where there might be some particularly tight places. And that's where we want to spend a little extra time. And again, you can just use a thumb or fingertips. And once you kind of dial it in there, you can hold steady. You know, there's a lot to be said for just consistent, steady pressure. And as a massage therapist, sometimes I struggle, like, if I'm not doing something, then I'm not doing anything. But in reality, the person that's receiving your touch is still receiving a great benefit, even if you're just holding steady in one place. It allows their nervous system to respond to what's happening. And as they take deeper, longer breaths, then they can start to relax into that experience. So there's a lot to be said for taking a moment of stillness in your massage. Your client can receive a lot even in those moments of stillness. And you may even be able to tune in and feel when the muscles begin to let go and soften, which is a really cool feeling to really feel their body respond. So I'm going to start making my way out into the top of the hips and the top of the glutes here. Again, this is another area where I like to use that kind of kitty paw or puppy paw, using the flat parts of the knuckles here. Because I've noticed, and this is at least true in my body, that the glutes can carry a lot of tension. It's a very dense and thick muscle group, and there's a lot going on here. And for me, I find that if I receive pressure that's like too deep, too fast, it can be extremely uncomfortable. But on the other hand, if somebody really takes the time to warm up the layers of muscles and slowly work their way into those glute muscles, it actually feels amazing. So I personally, as a massage therapist, I like to start broad, start at the surface, and slowly work my way deeper into the muscle tissue. And it's important to create that environment of safety and trust, that this person's body can really relax and receive your touch, because you're not going in too fast, you're not becoming invasive with your touch, but rather approaching the body like an explorer, discovering what you feel and really allowing yourself to tune in to the experience of what you feel in this person's body. And for sure, I can detect, just like we did in the low back and in the SI joint, using this as an opportunity to survey the land, and I can detect, where there's some knots or some particular areas of tension. And so now I have an idea of where I want to focus. And again, you can use this puppy paw to provide a more specific pressure. You can move a little bit more from the flat parts of your knuckle and slowly start to roll towards more of the bony part of the knuckle, but not necessarily digging straight in. Again, the glutes can be very sensitive, especially if your partner is dealing with a lot of sciatic or nerve pain. So we want to be gentle and loving with our partner's body and be very mindful about the pressure and the type of touch that you are offering. And another thing I'll mention here, on almost everyone, regardless of whether they have sciatic issues or not, most people spend a great deal of time sitting. And this naturally builds up a lot of tension in the hips and in the low back and around the sacrum. So anytime you can get in and work around the sacrum and work around that SI joint is going to provide a lot of relief for anyone who's sitting at their desk a lot, or anyone who is a commuter and spends a lot of time driving to and from work every day. There's all kinds of people that are suffering with this low back and hip pain, even if it's not directly related with sciatica. Now, after I've done this work into the low back, the SI joint, and the top of the hip, I like to provide just a nice side stretch. So focusing on the one side that I'm working, I'm bringing the heel of my hand right along the edge of the sacrum and the other hand to the top of the shoulder, and just leaning in my body weight and providing a gentle stretch here along her left side. And then we can begin to transition to the second side that you want to work. So I will let you kind of recap. We can kind of talk through this second side. So starting into the low back, using the broad, flat parts of the knuckles, making some long strokes or some circular strokes into the QL, starting to warm up that tissue. And then you can slowly start to incorporate more work with the thumbs, and using this as a tool, as a guideline to give you a sense of where the tension is being held. I actually feel a little bit more tension on this right side. So in a longer full body massage, I might spend a little extra time wherever I notice the most tension happening. So once you've indicated where that tension is, we want to just hone in with your thumbs or your fingertips, making gentle circles or just longer sustained pressure. And take your time and let your client breathe into that and receive that touch. Then once you've worked into the QL, we can start moving down into the SI joint. So again, working to create space there, being mindful about the amount of pressure that you're using, and really allowing yourself to get kind of detail oriented about the work that you're doing. Because again, we don't want to get involved like massaging over the bone too much. That just doesn't feel very good. But we work a little bit more attentively to get into the attachments, and that feels amazing. So just really pay close attention to the work that you're doing. And then after working the SI joint, then we come down and start to work into the tops of the hips and glutes, working again the flat parts of the knuckle, going from broad to specific. And once you notice any areas in the hips that are tight, you can use your thumbs, you could use your forearms or your elbows or any other tools that you have to start to zero in on those points of tension. Oftentimes I will still continue using the knuckles and just kind of lean in towards more of the bony part of the knuckles, allowing me to get more of a direct and specific pressure into the hip. And then again, once I've completed my work on this second side, just doing a side body stretch, bringing the heel of my hand down into that SI joint, the top of my hand, my other hand to the top of her shoulder, leaning in my body weight to just create a lengthening stretch from top to bottom. Then to finish, you can do some gentle rocking. This feels great for releasing any remaining tension. You know, rocking the body sends an automatic message to our nervous system, to our parasympathetic nervous system, to start to relax and unwind. So some gentle rocking can really help to finish out that experience. You may also enjoy doing a nice long traction stretch across the top of the sacrum, opening up space into the low back. You can put any finishing touches onto your treatment that you'd like. So thank you so much for following along with me in this video. I hope that this information has been helpful for you and inspiring as you venture out and share your healing and therapeutic touch with more people. Don't forget to trade places and allow yourself to receive some of this nurturing touch as well. Thank you for being a part of this community. Please visit my website, jenhilman.com, to learn more about me or to schedule your own massage. I look forward to seeing you next time. Until then, namaste.